One of the most neglected subspecialty in ophthalmology is neuro ophthalmology. Most of the cases we misdiagnose, and when we diagnose a case of neuro ophthalmology correctly, we don't properly manage these because of lack of proper referral systems. Now, this 50 years old male patient presented to me with complaint of loss of vision in the right half of the visual field, his visual field. And in this video, you can see I am performing confrontation visual fields, and both my eyes are open and the patient both eyes are open. One of the mistake which most of the viewers did in comments while diagnosing this case is that they have written right eye temporal field defect. Amal Shabir diagnosed it as a chiasmal lesion. Sidra Tahir answer was very comprehensive, but again she missed the trick by saying right eye hemianopia. Well, both eyes are open, so it's not right eye hemianopia. Supriya, Muzammil, Nemat, all were going for chiasmal lesion. But then right answer was given by optometrology that it is a right homonymous hemianopia. He can see up to my left eye. My left eye is in front of his right eye. So he has right homonymous hemianopia, right half of the visual field defect. From our previous knowledge of visual pathways, temporal retina carries medial visual field fibers, nasal retina temporal, and till optic chiasm field loss is unilateral. In optic chiasm we can have bitemporal visual field defects, and from optic tract onwards posteriorly right half of the visual field is carried in the left optic tract and left half of the visual field is carried in right optic tract. So now you must be clear that this patient had sudden loss of right hemifield. It means problem is in the left optic tract or left optic radiations. Now there is no history of trauma, so other common causes of right homonymous hemianopia are tumor and stroke. Now if hemianopia is very clearly defined, it means lesion is more congruous and more posterior, like this one. It seems to be in the left optic radiations, so I ordered MR brain, and you can clearly see that there is an infarct on the left side in near the occipital lobe that correlates well with the right homonymous hemianopia. So I referred the patient to neurologist for further management. And remember, the most common cause of hemianopsia in adults is stroke, which this patient had. So it was a good case of neuro ophthalmology that I diagnosed, and I thought I should share this patient with you. Thank you very much.